Even in the best of times, their work is demanding and difficult. But in these times of COVID, Lesley Stahl tells us, for thousands and thousands of healthcare workers, the trauma seems to never end.
As head of a top intensive care unit in New York City, Dr. Lindsay Leaf is no stranger to emergencies.
If the organs are failing and you need to be placed on life support, you come to us.
How much death do you actually see?
A lot. A lot.
But in March of 2020, she saw more deaths than she ever thought possible as COVID stormed through New York-Presbyterian Weill-Cornell's 5 South.
We heard about hospitals sort of crumbling in Milan. And we heard from colleagues there that there were patients literally dying on the floors of hallways with no oxygen. So we had that sort of fire in our belly that was not how it was going to be here.
But by April, it was a war zone with constant incoming. The number of COVID patients soared, ICU beds more than doubled.
To have hundreds and hundreds of patients with the same disease on maximal life support. I mean, I remember walking floor to floor to floor.
You were part of the small group that turned the whole hospital
essentially into ICUs.
Wow, that's breathtaking.
What they saw in that hospital was so disturbing to them, some of them still haven't gotten over it 2 years later.
Journalist Marie Brenner's new book, The Desperate Hours, describes New York-Presbyterian's early heroic battle against the COVID pandemic. There were no vaccines, no antivirals. Doctors were confronting the utterly unknown.
When doctors of any caliber, but of this level of expertise, are confounded by a medical mystery, they are both enthralled, they are in full adrenaline, but on some level, they're also terrified.
And overwhelmed.
I worked probably 2 months without a day off.
And then you go home at night. Do you actually sleep? Can you sleep? You can't.
Definitely not. When it's quiet is when all those feelings and memories of the patients or the colleague who was in tears, that's when that all comes back. I barely slept.
Yet she still helped her 2 young boys with their homework over FaceTime while struggling to run an ICU short on beds, masks, and everything else. Brenner writes, had New York-Presbyterian crumbled, the damage to the nation and the world would have been many times worse than what we did experience. Right before you were intubated, what did you say to your husband?
I love you. I said, you are now my proxy, so you have to stand in for me and make the decisions because I'm not going to be able to make them for myself.
Karen Bacon knew she might die. She was not just another 5 South COVID patient, a Weill-Cornell pediatric nurse. She was the first healthcare worker treated there for the virus. It was a wake-up call to them because, they were saying, oh my God, I could get this.
I can see that.
Yeah.
Yeah.
She was sick, and it was very upsetting, of course, for our staff to see one of our own in the bed.
Just 30 years old and a newlywed, Bacon went from a cold in February to a ventilator in March.
I think the hard part was going to sleep and then finding out it's 2.5, 3 weeks later.
Was it a coma?
Basically a medical-induced coma.
Like Bacon, every single Weill-Cornell ICU patient at the height of April was intubated. All the while, there was a ventilator shortage.
I have colleagues who to this day still, I know, talk about and think about decisions they made. Who got the first ventilator? Who got the first ICU bed?
Was there guidance from the leadership of the hospital?
We were told they were waiting for guidance from the governor. So meanwhile, my colleagues and I are, making decisions with our best medical judgment in mind. However, when someone with COVID died, which was every single day, of course, then you think, what if they had gotten the 3rd ICU bed and not the 5th ICU bed, right?
In early 2020, I personally believed that we were all going to die.
And without the proper tools to confront this mystery illness, Dr. Ben-Gary Harvey, a 5 South pulmonary and critical care specialist, knew the only answer was innovation. He started with COVID patient Susie Beebe.
She'd been on a ventilator 4 months.
Oh,
she was a
my
woman
God.
in her early 50s.
You can be on a ventilator that long?
She was at death's door. She had, huge holes in her lungs.
Dr. Harvey had an unconventional idea, implanting a Zephyr valve. Recently approved for emphysema, it works by stopping leaks in damaged lungs. But it had never been used at the hospital on a COVID patient, and many there rejected the undertaking as too risky. Still, it worked.
It just gives me the satisfaction that we can become creative, that we can continue moving forward, exploring new avenues.
And he said, if you stay in your lane when you are confronting this level of medical mystery, you're not going to solve it.
I figure that if I found a leak on Susie, I can put some of those valves to prevent air from growing into that part of the lungs.
But here's the operative word there. If.
Well, what is the alternative?
She would not have survived.
I don't think so.
Susie Beebe, is she okay now?
She's amazing. She was able, with help, weeks after she got out of the hospital, to be at her son's wedding with her medical attendants, to walk down the aisle with people holding her.
With so much death, victories were joyous celebrations. What was it like the day you left the hospital?
They had everyone at the nurses' station. They did the clap, they put a crown on my head. They just gave me the greatest send-off.
You know, we're sitting here talking as if this thing is behind us. Is it?
Absolutely not.
No.
No. But it's enormously inspiring to know that in the hospital systems, there are those who care so deeply and who did save lives at enormous cost to themselves.